we're concluding the day on a rousing note with Gareth Owens, Chair of Aortic Dissection Awareness UK and Ireland. Gareth probably needs no introduction, but just to say he's a hugely informed, phenomenal patient campaigner for Marfan and aortic conditions. As you'll discover during this, the grand finale to our information day, when Gareth will talk about a very important topic and tool, self-advocacy. Welcome, Gareth.
Victoria, Ann, thank you so much for your warm welcome. It's a pleasure to be here with all of our friends and Marfan patients. First thing to say is I have no medical qualifications whatsoever. I am a patient with Marfan Syndrome. I come from a family with Marfan Syndrome. My dad had Marfan's, and the youngest of our three children has inherited Marfan's from me. So I guess what I'm going to do is just share with you some anecdotes from a lifetime of living with Marfan Syndrome about how to self-advocate. And self-advocacy is just getting the best possible care that you need. So there's a sort of subtext here, which I will say is how to ace your healthcare journey, all right? How to ace your, and so hopefully I can share with you a few anecdotes from my experience of Marfan's over the last 50-something years that will be helpful in enabling you to get you and your family to get the care that you need. So that's where I hope we can go. The first thing to say about self-advocacy or getting the care that you need is that it's your job. And sometimes people, when they have a new diagnosis, don't realize that. They think, oh, well, the system will take care of me. But because because whether it's Marfan's or Loeys-Dietz or VEDS, these are relatively rare conditions. There is relatively low awareness and understanding of them, even in the general medical profession. It's very important to own the condition and realize that it's your job to get the care that you need. And that's probably my biggest learning of living with this condition, is how much I need to own it and inform myself and empower myself to get the right level of care for the different things that can be affected, because these are syndromes, they can affect us in many different ways. So I think everybody who's here today has taken a really important step. And the important step you've taken is coming here to learn and inform yourself. And what's amazing is just by being here today and listening to the presentations we've heard, you probably know more than 98% of the general medical profession about Marfan syndrome. That's the challenge with awareness. So, you're in that top 2% of people with knowledge already. And if you've got ongoing relationships with the Marfan Trust, you can draw on those resources and information, and you'll be a very well-informed patient. And that puts you in a position to look after yourself a lot better. So first message is, it's your job. Nobody else is going to do it for you. My experience of working with doctors over many years and having lots of different consultations for my Marfan syndrome is, I would divide doctors into three types. There's three types of doctor. There's those who know, like all the people we've heard from today. The people who are real experts in this condition, and in case of somebody like Anne, has made it their life's work to study and advance the care in Marfan syndrome. These are the people we want caring for us, because we need specialist care. We need somebody who really understands the condition. So those who know are the friends that we need to cultivate and make sure we're being cared for by. Then there's those who don't know, people who will willingly admit, sorry, I know nothing about Marfan syndrome. I may have heard about it at medical school, but that's about it. My GP is in this category. He says to me, look, Gareth, I'll look after your day-to-day healthcare needs, but those nice people at Bart's, where you have all your aortic surgery, they do all the clever stuff. And they'll look after you, and you need to be going out to see them. And when you are confronted by doctors who don't know, that's fine. What we need from them is a referral to a specialist who does know. And generally, they're very happy to do that and send you to the cardiologist or the surgeon or the ophthalmologist or the neurologist or whoever it is you need to see. So from those who don't know, we need a referral. And then there's the dangerous group, those who pretend that they know. And I had a situation once. I was having a general medical examination, and I obviously, like I always do, said to the doctor, I have Marfan syndrome. And this doctor paused and he looked at me and he said, Mr. Owens, Marfan syndrome. And you can see the cogs whirring in his head. And there was just a pause in the conversation while his face was rather blank as he cast his mind back 30 years to all the lectures he'd had in medical school to try and dredge up something that he had been taught about Marfan syndrome, because he wanted to show me that he knew. And after a short pause, I didn't really know what to say, finally a light bulb went on and I could see he'd got something. And he said, Mr. Owens, he said, Marfan syndrome. He said, yes. Abraham Lincoln, the US president, died of Marfan syndrome. And I looked a bit puzzled and I had to say to him, well, doctor, I'm not great on my American history, but as far as I recall, Abraham Lincoln may have had Marfan syndrome, but it was definitely the assassin's bullet that killed him. At which point he kind of got very embarrassed and we moved on to talk about some other part of the examination. So the ones who pretend that they know, it's important to realize that and make sure you get yourself a specialist who really knows what they're talking about with this condition. So that's kind of thing to bear in mind when you're in front of medical professionals. Then let me move on and say the second important thing you can do, apart from owning your own healthcare journey and advocating for yourself, it's really important to connect with people on the same journey. And I found that tremendously helpful, just to talk to other people going through the same things, living with the same conditions, and learn from their experiences. So today, that's me. I'm the guy who's trying to share some of his experiences with you. And the rest of this talk is really just some anecdotes and tips from my experience of 50-something years living with Marfan syndrome, and particularly relating to 4 body systems: eyes, heart, joints, and aorta. Okay, so that's what we're going: eyes, heart, joints, and aorta, which is the kind of 4 areas where I've had a big impact from living with Marfans. So let's start with eyes, and I'll just share with you that. So my dad, who had Marfans, lost his sight completely in his early 20s. He had retinal detachments and was completely blind. And so I'm an only child, and when I was born, there were lots of concerns about my eyesight. I would say probably the principal concern about me and Marfans was that I might lose my sight. I mean, I can remember at 8 years old, somebody suggesting I ought to learn Braille just in case. And you can imagine how an 8-year-old rebelled against that. But I wore very, very thick glasses for my whole teenage years. I also had lens subluxation, so my lenses were kind of above the eyeball, so far above the eyeball that I basically didn't have a lens in front of the eye. So I wore these really thick glasses with plus 13.5 magnification to make up for there not being a lens in front of my eye. And at school, of course, kids at school are very cruel. They used to call me milk bottle bottoms because they thought my glasses were the bottoms of the old-fashioned milk bottles. But nothing daunted, I got on with life and I was doing okay. And of course, Gareth wanted to join the Royal Air Force as a pilot. That's all I ever wanted to do when I was a teenager. And somehow I couldn't see the incompatibility between my milk bottle bottom glasses and wanting to be a pilot. But everybody else could, but I was in denial about that. Needless to say, I went and had the RAF medical, failed it completely. They weren't going to touch somebody with Marfan syndrome, not in any job, let alone as a pilot. And so I had to make an alternative plan for my life and career. And I ended up working in southern Germany in my early 20s. And one day I was sitting at the desk and the computer screen went blurred. And like you do, it's an old-fashioned computer screen. We didn't have flat screens back then. So I hit the side of the screen to try and get it to be sharp again. And that didn't work. And then I looked around and my colleagues were blurred and the desk was blurred and the room was blurred. And within about half an hour, a grey curtain just descended over my right eye and I'd lost the sight in it. But at least I knew to expect this with Marfan's. So I went, like you do in Germany, to the eye doctor. So I went down to the town to the eye doctor, who saw me and said, "Well, I'm just going on holiday this afternoon. It's 3:30, and I'm going on holiday at 5 o'clock. So make yourself an appointment with my secretary for when I come back in 3 weeks' time." And I thought, well, this is a retinal detachment. The thing I know about retinal detachments is if you don't fix them quickly, then the blindness becomes permanent. So I really wasn't happy about that. And I didn't know what to do about it. So rather foolishly, in hindsight, maybe with the recklessness of youth, I jumped into my car in Stuttgart and drove with one eye to Calais, where I took a ferry across to Dover and then drove up to Windsor. So that's about 900 miles. And went to see the ophthalmologist that I had seen when I used to live in the UK. And he was an ophthalmic surgeon called Jack Kansky. He wrote the book on retinal detachment, and he took one look at me and said, "You're staying here and I'm operating on you in the morning." And Jack operated on me and saved the sight of my eye. He did a thing called a scleral buckle. And that eye, I was 23 when that happened. And that eye has been absolutely fine ever since, not had a problem with the retina at all. So, I was very lucky to get the master of retinal detachment surgery to repair my eye at that moment in that emergency. So what's the lesson from this? Well, get the best specialist, even if you have to travel. I'm not going to recommend driving from Stuttgart to Windsor on one eye because it was a bit terrifying, but make sure you get the best specialist for the condition that you've got. Very often your local hospital isn't going to cut it for things that are related to Marfan's, and specialist care is a step above, really. I also had later in my 20s lens dislocations. Both lenses eventually became completely mobile and were bouncing around the eye. I went to the local ophthalmic surgeon who said, "I daren't touch your lenses because of the risk of retinal detachment." And I said, "Well, before I spend the rest of my life living like this, would you mind if I had a second opinion? Would you send me to Moorfields Eye Hospital for a second opinion?" Which he was very happy to do. And I went to Moorfields, and the medical director there at the time was Bob Cooling, who saw me and said, "Oh, yes, we are doing intraocular lens implants now in Marfan syndrome. For risk management, we will do one eye at a time." So I was just short of 30 when I had both lenses removed and replaced by intraocular lens implants at Moorfields. And that gave me better vision than I've ever had in my life. I couldn't believe it. My thick glasses were gone. I wore very thin glasses. And without them, I could even read the newspaper, which I'd never expected to be able to do. So being Gareth and being a bit of an aviation geek, I thought to myself, I wonder if I can get a pilot's medical now and fulfill my dream to fly airplanes. So I went off and had the tests, and sure enough, my vision had been improved so much by the guys at Moorfields by this surgery that I was able to get a private pilot's license and start flying in my 30s, which was so far in excess of any expectation I'd ever had of my life with Marfan's that I still have to pinch myself to think that I did it. It was brilliant. So it's amazing what can be done when you get the right specialist care and treatment. So 2 messages there: get the best specialist even if you have to travel, and never be afraid to ask for a second opinion. Let's talk about the heart. Annual cardiology appointments, if you have Marfan's, are really important. You should be having them, getting monitored. I had that from when I was 20. I'd go and have an echocardiogram and an ECG and my blood pressure checked. And I'd go every year and just make the time to do it wherever I was. And despite that, at the age of 41, I had a heart attack. We don't quite know where it came from. It was, for those of you who are medical, it was a non-ST elevated MI. When I had an angiogram afterwards, my arteries were completely clear. There was no coronary artery disease. So it was put down to, oh, it's one of those things. I had the drugs, the gold standard drugs you get after a heart attack. I did the cardiac rehab program. I recovered. I went back to work, got on with family life. And, a year on, things were pretty much back to normal. And so that was a bit of a shock. And we've never really explained why that happened, but it did. And the message for that is sometimes bad things happen, even if you're doing everything right. And the only thing you can do in those circumstances is seek urgent help. And when you've got a condition like Marfan's or Loeys-Dietz or VEDS, nobody is going to blame you for seeking urgent help if you've got a concern. If you turn up at A&E and you talk about your condition, nobody's going to say you shouldn't have come. You will get checked out, and it's better to be safe than sorry. So when bad things happen, seek urgent help and don't be afraid of doing it quickly. That worked for me. Joints. The winter is just settling in. I live in North Yorkshire. It's a cold, rainy day in North Yorkshire today, and my joints are starting to feel it again, like they do every winter. So in 2 weeks' time, we're heading off to Portugal, where we go for the whole of November, just to warm me up again. And so I get the sort of regular joint pain, not a lot you can do about it other than pain management. And I've got dural ectasia, which is this bulging of the column that contains the spinal fluid at the bottom of my spine. So if you look at an MRI scan, the bottom of my spine looks like there's a bunch of grapes, and sometimes they press on nerves, these little cysts. And I've had a couple of really, really severe painful episodes with it over the years, sort of got to the stage crawling around the lounge on my hands and knees, not really able to stand up properly. And both times I've gone and had an MRI and then seen a neurosurgeon. And both times the answer has been the same, which has been, it's far too risky to operate on your back while you can still walk. So the intervention is too risky. Manage it with exercise and pain medication. So that's what I do with the dural ectasia. I think it's one of those things that now that more of us with Marfan's are living into older age, it's becoming a more prevalent problem. But there hasn't been a lot of research into it. There aren't a lot of medical practitioners who know about it or can give you good advice about it. And it's maybe one of those things that in time we will make progress in through research and improving care. But at the moment, for me, it's one of those things that I conclude sometimes there's actually nothing that medicine can do for you, and you just have to manage it as best you can. And for me, dural ectasia is in that bucket. So it's worth getting checked out, but the answer there isn't an easy fix. And finally, so that's eyes, heart, joints, aorta. What I didn't mention about my dad, who had Marfan's, was he died of an aortic dissection at the age of 49 when I was 11 years old. And that was completely out of the blue. Just one night, he had a dissection in the middle of the night. The ambulance came and took him to hospital. Where we were in South Wales, there was really nothing that could be done for him with an aortic dissection at that point in time. So they made him comfortable, and he died about a week later. And so at the age of 11, having lost Dad, I had a lot of people looking at me, warning me of my risk of an aortic dissection. And this is the big risk with Marfan's. This is the one that can kill you. So you need to look after your aorta. And I was told that having Marfan syndrome conferred on me a 250 times greater risk of an aortic dissection than the normal population. So, and a dissection is a tear in the aorta, the big artery that carries blood from your heart to the rest of the body. So it's very serious. I was also told, and this is in the 1970s, but I was told that back then, my life expectancy was 32 plus or minus 16 years, which is a bit of a scary thing to be told when you're 11. What I'm very glad about is, as Jenny was saying earlier, and as Anne often says, 30 years of research have increased our life expectancy by 30 years. So now we can all expect to have a normal lifespan. That wasn't the case when I was 11. And so that's happened during my lifetime, which is absolutely wonderful. So Dad died of a dissection. I knew I had a risk. To be honest, my expectation of life was I'm going to pop my clogs of an aortic dissection before the age of 50, most likely. So I kind of did everything I wanted to do, career-wise, family-wise, lived my life as fast as I could, had a wonderful time. And then in 2016, I was in a pub in London one night. I'd been singing with my choir when suddenly I got the most intense onset pain that I'd ever experienced. I describe it as a hand with long fingernails was plunged into my chest and ripped from my shoulder down to my groin. That's what it felt like. My legs didn't work anymore. They sort of buckled underneath me. I folded into a booth in the pub. And I knew that I was having an acute aortic dissection. So I said to my friend, call an ambulance, tell them I have Marfan Syndrome, and I think I'm having an aortic dissection, which he duly did. Some policemen came with a defibrillator very quickly, and I said the same to them, and they said, oh, we're not touching you then, we'll wait for the paramedics. Paramedics came, and my good fortune was that they listened to me. They took a family history about my Marfans, about my dad. They took a pain history, sudden onset, severe pain like I'd never had before, in my chest, ripping down to my groin, radiating around my back, absolutely characteristic of acute aortic dissection. And they said, right, we need to get you somewhere that you get the right care for your aorta. And we're going to take you to a major trauma centre. The Royal London Hospital is not very far away. They pre-alerted the Royal London Hospital that a Marfan patient with an aortic dissection was coming in. And so I was met in the resus part of the emergency department by the on-call consultant vascular surgeon. And within half an hour, I was in the CT scanner having my aorta scanned, because the only way to diagnose an acute aortic dissection is a CT scan of your whole aorta. And you need it quickly because mortality for an aortic dissection is about 1% an hour. So, that people often suffer because they're made to wait a long time to get the scan. Half an hour I had the scan, surgical team on standby. It was what's called a type B dissection, so it was not kind of immediate surgery that was required. So I was put into the high dependency unit, and I remember calling Dr. Child and saying, I've had an aortic dissection and I'm sitting in high dependency. What do I do now? And she, in her usual calm style, said to me, well, Gareth, what type of dissection is it? I said, it's type B. And she said, okay, then we've got a bit of time to make a plan. And that was so reassuring at the time that, to be there with all this intensive care stuff going on around me, my life flashing before my eyes, thinking this happened to Dad, and then it's history repeating itself. To hear somebody who's qualified say, we've got a bit of time to work out a plan, and you should ask these questions, and this is what you should say to your team, was absolutely invaluable. And I'll always be grateful for that, Anne. And I know very often when I talk, I speak about it because it's one of those things that's really clear in my mind from the most vulnerable time in my life, actually. So thank you. So I'm very fortunate. I went over to Bart's Heart Centre. I had a massive operation. They replaced my aorta in 2 stages, 2 10-hour operations, all with lots of attendant risks. In total, I was in Bart's for 3 months. And I live in North Yorkshire, so my wife was kind of camping out around London and the children were visiting me. But the thing about aortic dissection, unlike when my dad died, is in the 21st century, there's medical and surgical techniques that can save your life if the diagnosis is made promptly and you get the specialist care that you need. And I was fortunate enough to get all of that, prompt diagnosis, gold standard specialist care. And it was a surprise to me when I came out of hospital to find out that most people who have an aortic dissection don't get that. 75% of them don't make it. And so I got involved with Aortic Dissection Awareness, which is the national patient charity that I now chair. And we launched a campaign called Think Aorta that some of you may have seen to try and educate clinicians about how to make the diagnosis and that good outcomes are possible if you make it and transfer patients for specialist surgery. So that's why I do what I do. We're big fans of aortic specialist centres, which is kind of part of the theme I've been talking about, really, getting the right specialist care. The literature tells us that patients with aortic disease do better when they're cared for by specialist aortic centres. There's a few of them in London: Bart's, the Brompton, Guy's and St Thomas's, King's, St George's. There are others around the country: Southampton, Bristol, Birmingham, Liverpool, Papworth in Cambridge, Newcastle. So these are real centres of aortic specialist expertise, and they're good places to get your aorta cared for, because it is a very specialist game, is caring for your aorta. So make sure you get the right specialist care, and awareness of this disease and how it can impact us in an extreme situation saves lives. And that's been my experience all along. Marfan's has kicked me in the teeth with something acute every 10 years, roughly. You know, the retinal detachments, the lens dislocations, the heart attack, the aortic dissection, roughly every 10 years. And in between, I've just lived a very happy and normal life. But awareness, being informed, being empowered, having the right specialists around you is what you need when those acute events happen. And sometimes we can prevent the acute events if you're getting the right care. Okay, so those are my little 4 kind of healthcare anecdotes: eyes, heart, joints, aorta. So just as a recap, take responsibility for your and your family's care. Own it. Sometimes I say ACE it. ACE your healthcare journey. ACE stands for advocate, communicate, and educate. Advocate, communicate, and educate. And the final tip I'll leave you with is this: because awareness of our disease is so low in the medical profession, because you now know more than 98% of the general medical profession about this condition, I'm going to encourage you after today to treat every encounter you have with a medical professional as an opportunity to teach them something about our disease. So try and have those conversations and change the dynamic of the conversation. You have the lived experience of this condition that actually a lot of clinicians could benefit from hearing. So I spend a lot of time talking about Marfan's and aortic dissection from a patient perspective to clinicians who are really interested to find out about it. So when you have your next appointment, treat it as an opportunity to teach the medical professional something about Marfan's or whatever it is you're talking about, eyes, aortas, and just make it a learning experience for both of you, and you'll have a better conversation. That's all I had to say today, really. I hope you have enjoyed listening to that. It's my very personal experience, but hopefully some of the tips I've shared will resonate with some of you and enable you to take ownership of getting the care that you need for your life with your condition. Thank you very much for inviting me, Anne and Victoria, to speak.
Thank you very much, Gareth. It was superb. I don't know if anyone has a question for Gareth. I just know from I lead a parents group that many parents reach an impasse with their child's doctor, who may be, I don't know, reluctant to refer them for a second opinion sometimes, and how to surmount that impasse.
It's a very good question. I mean, most practitioners, especially those who know that they don't know, will more than happily refer you to somebody who's got more expertise. But occasionally you'll find somebody who's a bit dismissive and says, oh, no, you don't need to worry about that. So I talk to people who are concerned about their aortas, or concerned about the genetic risks to their aorta, and they will go to a GP who will say, no, nothing to worry about. Aortic dissection is not a genetic condition. Well, of course it is. And the tip we usually give to people, whether they're a parent or whether they're advocating for themselves, is this: if you don't get the answer that you want, just say to the doctor very politely, well, okay, thank you, I respect your decision. First of all, would you explain it to me, what the rationale is for what your decision is? And secondly, just so that we've got a record, please would you write it in my notes? If you're refusing my request, please write it in my notes and write down why you've made that decision. And that often changes the conversation.
That's a good tip. It's a really good tip. are. Jenny says that echoes so much of my husband Michael's experience. Thank you for your helpful tips to other sufferers.
Jenny, thank you for that. I was listening very carefully when you were talking about Michael, and I was noticing the synergies between our lives with Marfan syndrome. So I do appreciate you sharing that. Thank you.